It's not uncommon today for spouses that are both on Medicare to want to be on the same type of Medicare plan. And frankly, that's usually the best idea. And the reason for that is because sometimes they will see the same doctors, they prefer the same hospitals, and the healthcare services that they need, they want those to be provided for them, managed for them, as well as paid for them in the same way. And that's why it's critical for couples to understand, number one, their Medicare insurance options and the differences of those options. And then secondly, for them to understand the unique options available to them financially when it comes to supplemental plans. And it's these two items that I'll be covering in this video. Let me begin by just reminding you that when you go on Medicare, you basically have two insurance options. It is very, very rare that people are going to do A and B only. There's just a tremendous amount of financial risk in that. So most people are not going to do that. So the great majority of all people are going to do one of two things. So you're either going to have a Medicare Advantage plan, which are also called replacement plans or C plans. This is a private health insurance company that replaces Medicare for you. Or they stay in original Medicare and buy a supplemental plan to fill in the financial gaps that Medicare did not cover. So these are the two predominant systems now that are available. And so let's do a comparison of these. Now, as we talk about today's video, I want to make sure that you understand that I'm really going to break down 6 different components that you need to understand about these plans and their differences. And then when I come to the end, we're really going to focus on couples and the cost that couples can really save if they decide to go with the supplemental plan. So we'll get to that at that particular time. So again, what we're going to do is we're going to compare Advantage plans versus supplemental plans in these particular items. So I actually want to start with this particular comparison, and that's comparing perks. Now, perks are these add-on benefits, additional benefits that oftentimes you're going to see in Advantage plans. In fact, as we make the comparison, when it comes to Advantage plans, you're going to notice that there will be several perks, supplemental plans, minimal perks, or no perks that will be offered. Now, those perks usually include some type of a gym membership, normally a network of silver sneakers or Renew Active. They oftentimes will include a vision benefit of 1 annual exam a year and some credit towards eyewear. Sometimes they'll have an over-the-counter card. They'll allow you to do $50 every quarter to go and buy over-the-counter type items. So sometimes they have hearing aids. Sometimes it's a copay plan for hearing aids. Other times they'll just cover a certain amount of whatever hearing aid that you would like. And so as we talk about the perks, I want you to know, first of all, they are legitimate for sure. Okay, I'm not minimizing them. They are legitimate perks, but the problem is they can be very limited in use. In fact, that's really one of the ways that these Advantage plans have functioned, because the majority of these perks are not utilized because they have limitations. They have restrictions. Sometimes there are network restrictions. Other times someone wants to use a benefit and just simply can't find someone that's going to cover that service. And so the point is, though legitimate, they are limited. In fact, there was a recent report out that came after a hearing about dental coverage before Congress. In fact, let me just read that to you. I thought it was very interesting. This actually came out just in the middle of May. And so they were having a subcommittee hearing with Congress, and there was a lady who spoke there. Her name was Dr. Lisa Simon, and she is an associate physician at Brigham and Women's Hospital and a member of the faculty at Harvard Medical Center. And she testified this. She said fewer than half of Medicare beneficiaries see a dentist each year. And when they do, they spend more than $1,000 out of their own pocket on their care. She also told senators that during the hearing that dental coverage offered, now listen to this please, that dental coverage offered by many Medicare Advantage plans is insufficient. Such plans offered by private health insurance companies roll together A and B and their coverage and include drug coverage. So again, she's talking about Advantage plans. Here's what she said. Dental plans are often a draw for beneficiaries that choose Medicare Advantage, again, because of the perks. She went on to say, but my research has found that beneficiaries with Medicare Advantage plans have rates of dental access that are just as low and out-of-pocket costs that are just as high as traditional Medicare beneficiaries. She said Medicare Advantage is not the solution here. And so the whole point is this, is what I was trying to teach you, is though it is definitely a legitimate perk, it can be limited because of providers that are going to take that. And so when we talk about these two areas here, the reason that Advantage plans are going to advertise the perks and agents talk about the perks so much is because what we have with them is, though we have lots of perks, we have low grade medical coverage. Supplemental plans, minimal or no perks, but what do we have here? we have high-grade medical coverage. So when it comes to insurance, when you get cancer, have a heart issue or whatever, we're going to see much, much better coverage over there because that's what supplemental plans are all about. Advantage plans, again, are going to be all about the perks. All right, that brings us to number 2 item, and that is I want to talk with you about providers. And what I mean by that are people who you're going to get your healthcare services from. There's going to be primary care doctors, specialists, surgeons, durable medical equipment providers. And what we do is we look at these and we make this comparison. We see definitely this. Advantage plans are going to have networks. In fact, that's frankly the only way that they can work financially for the Advantage plans. They got to put together a network of providers under a contract that are agreeing to provide services for people who enroll in these plans. So these are truly network types of plans. When it comes to supplemental plans, we have what we call an open access system, which means what? We have no networks at all. Advantage plans will always have a network where supplemental plans do not at all. In fact, if someone has a supplemental plan, they can go anywhere they want as long as that provider is going to take original Medicare, which is probably 99% of all doctors, 100% of all hospitals are going to take original Medicare, so they will take your supplemental plan again. Why? Because we have no networks. Now, the reason I emphasize this between the 2 plans is this. What you have with networks, you can have some difficulties, and the reason for that is because why? Because you're going to have limited providers. Over here, it's almost unlimited providers, but here limitations because not every doctor is going to take all the Advantage plans. We may see a doctor that takes PPOs and not HMO plans. We may see a doctor that is taking a plan 1 year and things don't go well, and they drop the Advantage plans the next year. Okay, so the whole point is when it comes to networks, they true are ever changing all the time. They change, right? And so we have issues because of that. Another issue that we have when it comes to networks is this, especially on the HMOs, many times if you want to see a specialist, you actually have to have a referral to see a specialist. Over here, doesn't matter. As long as they take original Medicare, again, you can go anywhere you want. There's no referrals required whatsoever in that supplemental system, okay? And so my whole point is here, when someone enrolls into the Advantage plan, they have to understand that they're agreeing to this network of providers. And again, it's changing. It's very, very fluid. Another issue is this, when it comes to where you can go. Over here, watch this. You realize that if someone enrolls into an HMO plan, they cannot go out of their network. In other words, they have to stay in the network at all times. The only time they can ever go out of network is if it's an emergency situation. That's it. Otherwise, they have to stay in the network. If they're on the HMO and go out of network, that HMO pays nothing whatsoever. Now, what's interesting is the PPO will let you go out of network, but the problem is it costs you a lot to do it. I looked at a plan just a couple days ago, and it was a PPO plan, and the in-network copay for a primary care doc was, I think, was $10. But if they went out of network for a primary care doc or a specialist, it was a 40% co-insurance copay. So that's very expensive to do it. If I stay in my network on the PPO, I may spend $5,000 in the year. If I go out of network, I could spend $10,000 or $12,000 for the year. And so the whole point is the PPO does give us out-of-network privilege, but it's very expensive to do that. Again, with HMOs, can't go out whatsoever unless it's an emergency or a urgent care type situation. So my point is this, you have to realize we have restrictions. Again, if I have somebody that wants an Advantage plan, and let's say they have maybe 4 or 5 doctors, almost always, we're going to have a difficulty finding one plan where all those doctors are taking the plan. Maybe 3 of the 4 docs take it, or 4 of the 5 doctors take it, but there may be one that does not. And so what happens? Either they're going to have to change doctors or have to find another plan where they can get the majority of their doctors covered. We never encounter that kind of an issue when it comes to supplemental plans. Why? Because 99 to 100% of all doctors are enrolled in the original Medicare system, and therefore they will take your supplemental plan. All right, that brings us into the third item I want to compare with you, and that has to do with decisions. In other words, who's making our healthcare decisions for us? All right, and again, there's going to be a difference here. So if we decide to enroll into an Advantage plan, they're called managed care plans. And that means the insurance company is managing and overseeing, really orchestrating the care for you. So here's what happens. Let me just give you a very simple example. If I'm on an Advantage plan, managed care plan, and I go to my doctor, and the doctor says you need an MRI or a CAT scan or a PET scan, or doctor says you need a knee replacement or a hip replacement, something like that. What happens in the managed care plan, the Advantage, the doctor just simply recommends, okay? The doctor does not decide. Doctor simply recommends a service, but 70% of the time when the doctor makes a recommendation, that is going to have to be pre-approved by that Medicare Advantage company. Okay, so we call these pre-authorizations. Pre-authorizations. And again, the stats are about 70 to 72% of services needed are going to have to be pre-authorized. And so what happens is this. Doctor recommends, they submit proper paperwork, justification for surgery or CAT scan or whatever you need, and then the company here has to agree. They have to approve before it's covered. If they don't agree and don't approve it, it's not going to be covered. You'd be out of pocket on that. And so what really happens is this. That insurance company that you enrolled in, what happens? They are the ones that decide. Okay, they truly have the final say-so. And sometimes they will decide immediately they're going to cover it. Other times they actually will delay, meaning I've had people that needed a knee replacement. They said, no, we want you to go to therapy for 9 months first. And so sometimes they delay coverage. I've seen flat denials. Had a lady not long ago that needed a full hip replacement. And they said, no, you don't. We believe you just need a rod inserted, and that's sufficient. We're not going to pay for a full hip. And that's all she got. Okay, so the whole point is now we have insurance company that can interfere with healthcare services that your doctor believes that you need. In fact, you can go online and you can look at all the different complaints that come through because of this pre-authorization process. Okay, now when it comes to supplemental plans, they are supplementing original Medicare. Original Medicare is fee for service. And that just simply means that if you need a service, your doctor says we're going to do an MRI or a CAT scan or do a knee replacement or hip replacement, then everyone knows in advance exactly what that surgeon, that doc or provider is going to get for that particular service. Okay, so it's fee for service. It's not a managed care plan. And so what happens then, truly, your doctor makes the decision. Okay. Now, of course, it has to be a service that Medicare is going to cover, which is the majority of things for sure. Okay, so Medicare has things they'll cover and a few items they won't cover. But as long as Medicare covers something, there's no additional inquiry into whether it's going to be covered or not. Medicare says, we'll cover this, and your doctor says that you need this, and what happens? You're going to get it. So the whole point is the doctor makes that final decision. The insurance company has no say-so whatsoever. So here's what I'm trying to teach you. When you have a Medicare supplemental plan, those supplemental plans follow Medicare. They follow Medicare. So if Medicare says we're going to cover this, doctor says you need it, Medicare covers, and the supplemental plan is going to follow. They can't intervene, they can't interfere, they can't disrupt anything that your doctor says that you need. Okay, so they follow Medicare. Now, if Medicare is not going to cover something, well, then the supplemental plan is not going to either, with the exception of foreign travel. But the whole point is this: you don't have to run any kind of you're not going to run any kind of situations where if doctor says you need it, you're not going to get it in this system here. So again, you have to decide what do you want your health care to look like. If you had some need of certain services here, got to be pre-approved here. That's not going to happen. Hey, if you found this video helpful and if you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. Now, the fourth item that's very important to understand has to do with certain terms of these plans versus, again, Advantage versus supplemental plans. So the first thing that you have to realize that when you enroll into an Advantage plan, it is just a calendar year plan. So I'm shooting this video today. It's May 30th, 2024. If someone's going to start Medicare June 1 and they're on that Advantage plan June 1, it is their plan now for the next, 7 months. That's it. Why? Because it's a calendar year plan. These are agreements under contract between Medicare, the Advantage company, and you. But it's calendar year and calendar year only. Okay? When it comes to supplemental plans, they're lifetime. They truly are written for life. The insurance company can never cancel your supplemental policy once it's approved. They cannot cancel it except for non-payment of premium. It is truly yours for life. All right. So here's the point. These are ever changing, as we talked about. They're just calendar year plans. So we'll see in a market, we may see 10 companies offering plans, and the next year there may be 15. Or we see 10 this year, and next year there may be 8 plans offering, 8 companies offering plans. Okay, why? Because they're only obligated to be true to that contract for that plan year. All right, so that would be a big difference. Also, when it comes to Advantage plans, we talk about these terms. These are what we call service area plans. these are tied to a service area. This is a geographical location, normally a huge metropolitan area. Sometimes it could be half of a state or a whole state, but the point is tied to a service area. These are tied to you. These are tied to the insured. All right? And so what do I mean by that? Well, if I have an Advantage plan and I move out of my service area, I live in Denver and I'm going to decide to move to Miami, you're not going to take your Advantage plan with you. It's not going to happen. You're going to have to get a different one when you move to Miami. They're not portable policies because they're really not tied to you. They're tied to that particular service area. When it comes to supplemental plans, they're tied to you. So if you live in Denver, you move to Miami, you take your supplemental plan with you. The insurance company can't cancel that because you relocated. They can't cancel it because of age. They can't cancel it because of claims. That supplemental plan is yours as long as you pay the premium. All right? And so that is a big deal as well. Another very interesting thing about the terms of Advantage plans is this. You basically have no foreign travel coverage. Okay, now the exception to this would be emergency room. If you go to the emergency room and you're out of the country, then they will cover you at a zero copay at the emergency room. But if you're hospitalized, you have no coverage, you have anything going on beyond that emergency room visit, you have no coverage whatsoever. Okay, that's a problem. Now, when it comes to supplemental plans, of course, there's 10 different supplemental plans. 6 of the plans actually offer foreign travel. Certainly everything that we write, but we have foreign travel. And what I mean by that is this. What happens on a supplemental plan that covers foreign travel, this means you're outside of the 50 states, you're outside of the U.S. territories, and you have an issue come up, they will pay up to $50,000 in a lifetime for a claim that you may have outside of the country. What happens is you pay a $250 deductible, okay? So we got a $250 deductible, and then the company, the insurance company, takes that bill that's after the deductible, that balance, and they will pay 80% and you pay 20%. Now their 80%, of course, going to stop at 50 grand, but at least we have something if we travel outside the country. Now, frankly, if I'm traveling outside the country and on Medicare, I'd probably, either way I go, I'm going to get some travel health insurance in case something happens. But here, I could really be stuck because that's all that's covered. Here, at least I have $50,000 available for me. All right, and so these terms are going to be different. All right, that brings us to number 5, and that has to do with when we set plans up, either Advantage versus Sup. Initially, when we go on Medicare, either at 65 or when you retire at 67 or 70 years old, whenever you go. Okay, and then we'll talk also about switching. Okay, so when we talk about Advantage plans, and again, I'm referring to initially when you start them. Let's say you're going to start one at 65. This is what we call your initial enrollment period. All right, and so you can enroll into Advantage plan at 65 or 67. If you come in at 67, that just simply means you've been covered by an employer-provided plan, and then you're going to retire, drop that plan, and go on your Medicare Advantage plan. So at 65 or 67, either way, we can come in and we can get that plan. Okay, now, when we get that plan, there's no underwriting whatsoever required. So as long as you're enrolled into Medicare A and B, you live in the plan service area, you can enroll initially into that Advantage plan. Okay, and so very, very simple. They have to take you if you want the plan. No underwriting at all. Now, when we talk about switching Advantage plans, here's the way they work. Okay, now we're talking about switching Advantage plans, so I want to make sure we're real clear. Advantage plan to Advantage plans. Okay, this is someone that's on Advantage plan. They're with ABC Insurance Company, and next year they want to go with XYZ Insurance Company. So they're moving Advantage to Advantage. We actually can do this 2 times a year. We can do the switching October 15th through December 7th. And if I switch then, my new plan starts January 1, or I actually can from January 1, if I'm on Advantage plan, all the way through March 31st, I have a second opportunity to switch Advantage to Advantage. Again, moving from ABC company to XYZ company. And I can do that the first 3 months of the year. If I make that switch in January, my new plan starts February. If I make the switch in February, new plan starts March. Make the switch in March, my last month, then it would start in April. And so the whole point is we have this 3 months plus these 7 weeks here where we can switch Advantage to Advantage. No underwriting. As long as you live in the service area, you can make that switch. Now, where it gets tricky is when someone is on an Advantage plan and they would like to move to a supplemental plan, okay? A supplemental plan. So in other words, they say, I'm done with that system of networks and pre-authorizations and those kind of things. I want to get out of that, and I would like to get a supplemental plan. So here's what happens. Unless you live in one of 5 states, which would be New York, Connecticut, Vermont, Maine, Massachusetts. Let me say it again. New York, Connecticut, Vermont, Maine, Massachusetts. Unless you live there, what happens, there's some very strict switching rules from Advantage to a supplemental plan. And what that means is if I want to make that switch, and I've been on that Advantage plan, let's say, a year, 2, 3, 4, 5 years, whatever period of time. Now what happens is you have to go through medical underwriting to make that switch. Okay? Now, those 5 states that I mentioned, you don't have to. But the other states, to move to a supplemental plan, what has to happen, you've got to go through underwriting, and that's a process, which means we have to ask you about 35 or 40 health questions. We're going to check all your medications you're taking now and have for the last 2 years to see what you're being treated for, and may need a statement from your doctor called an attending physician statement. And we take that medical information and we submit that then to an insurance company that offers supplemental plans in your area, and they have the right to go through underwriting. They have the right to look over your situation, your pre-existing conditions, your medications, and they have the right to say, no, we're not going to approve that case. We're not going to insure you. And they can do that because the supplemental plan now has the right to go through this underwriting process with you, all right? And so this can be a real issue if people, if their health has changed. So they're on an Advantage plan, they're on it for, let's say, 3 years, and now they're diagnosed with cancer. You're not going to get to switch until you're cancer-free, treatment-free for at least 36 months. If you have insulin-dependent diabetic and you've had any complications, retinopathy, neuropathy, diabetic coma, or an amputation, you're never going to switch into a supplemental plan. If you have spinal stenosis, rheumatoid arthritis, you have AFib in your medical records, one AFib incident, you're not going to get to make the switch. So what happens, many times people would like to switch, especially when they see their health changing or they're concerned about that, and now they can't. So they would then be stuck in that Advantage system really for the rest of their life because they can't pass underwriting. All right? So again, that's the Advantage plan. Let's talk about supplemental plans. Now, supplemental plans have what we call a Medigap OEP. Let me just write this out so you're clear on this. Medigap OEP. Now, what I'm teaching you is initially when you go on Medicare at 65 or at 67 or age 70, when we go on Medicare, and the key date is this. Watch this. The Medigap OEP, Medicare Open Enrollment Period, is actually tied to the B date. Now, if someone starts Medicare at 65, their Medicare A date and B date are the same. If they're going to start, let's say, here in a couple days, they would be 6/1/2024 A and B. But sometimes people enroll into A only, keep working for a couple years, and then they pick up B at a later date. But whenever we pick up the B date, whether it's 65 or later, that B date is the key date to this Medigap Open Enrollment Period. And again, unless you're in those other 5 states, what happens is you have this opportunity that lasts 6 months. And this 6 months, in fact, let me just write it here for you real quickly. Let's say someone's going to start right this next couple days, 6/1/2024. And this is going to be their B date, right? So 6 months before or 6 months after, they're in their Medigap OEP, Open Enrollment Period. They can apply for a Medigap policy in advance. Now, their coverage is not going to start until their Medicare starts, of course, but they can do it in advance, and most people do, anywhere from 3 to 6 months. But once our B date is established, we're still in this open enrollment period window, 6 months, where there's no underwriting at all allowed. In all 50 states plus DC, the insurance company is not allowed to ask you any health questions whatsoever. You could be in the midst of cancer. They're not going to know it because you don't have to tell them, and they're going to cover it. There's no exclusions at all. They have to cover everything, 6 months of the B date. So that's what we're saying. This is a very critical opportunity. Even for people that have serious health problems, they will get that policy issued and approved. And again, pre-existing conditions are covered because the insurance company legally can ask you no health questions whatsoever. They have to cover you. But watch this. Once that 6 months is over, except in those 5 states, New York, Connecticut, Vermont, Maine, Massachusetts, if you ever want a supplemental plan after that 6 months, now you have to medically qualify. So let me show you how this works. So in this example, this person would be all of June, July, August, September, October, November. This means in this example, December 1 of 2024, moving forward, if they ever want a supplemental plan, now they're going to have to go through this medical underwriting process, okay? And so that's why we're saying this 6 months is very, very critical. Now, let's talk about switching plans. switching plans when it comes to supplemental plans, number one, you never have to if you don't want to. Why? Because they're written for a lifetime. That insurance company can never cancel your policy because of age, because of claims, a lot of claims, because you moved. That policy is yours for life. But sometimes people from time to time want to move their supplemental plans. So what I'm trying to teach you is this. When it comes to switching supplemental plans, it looks like this, sup to sup. All right, sup to sup. Now, normally in most states, right now that would be about 34 of the 50 states. To move from sup to sup, you are going to have to go through medical underwriting, okay? So we got to ask you those 35 to 40 health questions. You got to go through underwriting to make that switch. Why would someone do that? Well, maybe your rate's gone up, you want to shop, and maybe there's somebody offering a little bit of a lower rate. That does happen from time to time, and so, but we got to go through underwriting. Now, in 16 of the 50 states, we have what's called birthday rules or anniversary rules, and they'll let you at a certain time of the year, usually around your birthday or the anniversary of your policy, move from a supplemental plan with no underwriting. You can move from your G to G, N to N. Sometimes you can move from a G to an N. Sometimes you're on an F plan, you can move down. So the point is we have these switching rules in 16 states where there's no underwriting required. It's tied around your birthday or the anniversary of your policy. Okay, so that's switching the plans. But keep in mind, you don't have to switch. In fact, the majority of people don't switch. But if we ever want to do that, we can. Now, sometimes people, they may be on a supplemental plan and they want to switch to an Advantage plan. They say, hey, I like the perks. That's what I want. I don't want to pay a premium anymore. And so what happens, you can make that switch. But again, you can only do that once a year. And that is October 15th through December 7th. And so if you decide you want to do that, that would be the only time you can switch to the Advantage. And again, to switch to Advantage, there's no underwriting whatsoever. Okay, so just want to highlight these key differences between these two systems. Hey, if you're finding this video to be helpful and you would like to learn more about Medicare, you'll notice up here in the right-hand corner, there's an eye. And if you'll click on that eye, it's going to take you to a 20-minute workshop. I see people make mistakes all the time, and we don't want that to happen to you. And that's why we're giving you free access to this workshop. So go ahead, click the link, and learn more about Medicare. All right, that brings us to the last one, and now we're going to talk about costs, specifically kind of out-of-pocket cost for sure. So when it comes to out-of-pocket cost, again, there's certainly going to be a comparison. So let's first look at the Advantage plan. I want to note this right here. So when we talk about Advantage, when it comes to premiums, right now, 2 out of every 3 Advantage plan on the market actually has a zero premium, okay? Meaning there's no cost to the insurance company to have that plan. 1 out of 3 has a cost. Now, again, we may see some changes into 2025, but for now, most of them are zero premium plan. Now, keep in mind, to have that Advantage plan, what do I have to do? I've got to be enrolled in A and I've got to be enrolled in B. Now, for 99% of all people, Part A is zero premium because we pay taxes all of our working life, so they don't charge us a premium for Part A. But B does have a premium. Right now, most people that are on Medicare B are paying $174.70 a month for their Part B coverage. That's about 90% of the population. If you're high income, then you pay more than that. Those are called IRMAs. And so if I am high income, they're going to add my IRMA, which is an income-related monthly adjustment amount, to that premium. But my point is, to have an Advantage plan, I've got to pay my Part B premium this year, $174.70. No premium to the insurance company, and the reason for that, instead of paying a premium to the insurance company, now what's going to happen, I am going to be involved in a pay-as-you-go system. Okay? A lot of times people think that Advantage plans are going to be free. Well, they may have a zero premium, but I can assure you, you're not going to go to see a specialist at zero cost. You're not going to the hospital zero. You're not going to get an MRI or a CAT scan. You are going to have a copay. Hospital copay right now is about $350 a day. MRIs, CAT scans, about $250 per scan. Specialist visit, about $50. But we pay as we go. Okay? And so what happens with the out-of-pocket expenses, we pay as we go until we hit what's called the max out-of-pocket for the year. Max out-of-pocket. So the same max out-of-pocket is $5,000. So I pay copay until I hit my $5,000, and then I'm done. Put your purse away, checkbook away, wallet away, put away. You're done for the year. And then these max out-of-pockets reset every January, and then again we're back to paying copay until we hit the max. So again, I'm just trying to teach you the structure of these financially. That's how they look. Now, when it comes to supplemental plans, again, I've got to be enrolled in A and B. Right? So that means I got to pay that Part B premium. Most people, again, $174.70 a month. But also what's going to happen is now if I'm going to do a supplemental plan, what I'm doing is I'm buying from a private health insurance company a supplemental plan, also called a Medigap policy, to fill in those financial gaps that Medicare didn't cover. Because Medicare doesn't cover anything 100% other than preventive services. So you go in for a certain shingle shot, or you go in for a wellness exam. Those kinds of things are called preventive services. They're covered at 100%. But nothing else is. Everything else, you're going to have some financial liability, some financial responsibility. We call those gaps in coverage. Gaps. And in the Medicare system, there are actually 6 gaps. There's 3 gaps on the A, and there's 3 gaps on the B. And so you are responsible financially for those gaps. And that's why I always tell people A and B by itself wouldn't do it for a second. There's just too much liability. So what happens when we talk about supplemental plans, we're transferring the liability of the gaps, most of the gaps, to an insurance company, so we don't have to be out of pocket. So we have to pay them a premium for them to take that liability from us. Now, the majority of people today are getting a G plan or an N plan. They're both wonderful options. They are. The G plan covers 5 of the 6 gaps. So by paying a premium to the insurance company, they're going to pay 5 to 6. You're only responsible for 1 with the G plan, and that's called the Medicare B deductible. Once a year, you have a B deductible. This year, it's $240. Okay. Now the N plan, again, the second most popular plan, covers 4 of the 6 Medicare gaps. Again, it like the G, it will not cover the B deductible. That's very manageable, $240. And then the N also will not cover excess charges. Excess charges are very rare. When it happens, this means that you've seen a doctor that does not agree to take Medicare reimbursement rates as payment in full. In other words, they don't participate in that fee-for-service where they take whatever Medicare is going to pay and you pay the balance. They add to the bill. They add to the bill 15%. That's called an excess charge. And if you had an N plan, excess would not be covered. You would have to pay for that. G covers it, but N does not. Now, it doesn't happen often. Less than 5% of doctors even charge excess, but it could happen. But the point is this, the N will not cover it if it did happen. Plus the N, every time you see a doctor, you're subject to a copay of up to $20 to see a doc and $50 to go to the emergency room. All right, so we have a few more out-of-pocket expenses. So they're both great plans. The G plan right now on average is about $130 a month. N plan's about $100 a month. Now listen, you may live in a state where that's higher than lower. I'm just telling you across the board, we're a nationwide broker, so I just gave you kind of a national average. So $130 for the G, someone turning 65, $100 for the N plan right now. All right, so you just have to decide what's important to you. The $30 makes a difference, then N plan's going to work. If not, if you don't care, 30 is not going to make you or break you may want to go with a G plan. Again, there is no better, best, good, bad at all. It's just whatever you're comfortable with, okay? So the whole point is now we've transferred the liability so we don't have to pay as we go. In fact, if I have that G plan, I paid my monthly premium, and the only thing I'm out of pocket once a year is my B deductible, and I'm totally done. So we almost have 100% coverage, not quite. And the N plan, close with a few copays. But what I'm trying to teach you is we pay differently in these two systems. Now, here's what I want to clarify. As we talk about couples, here's really where it gets pretty nice. When it comes to couples that decide to get plans, we have what are called household discounts. Household discounts. Now, keep in mind, our company, we are brokers. We write for lots and lots of carriers. In fact, probably almost anyone that you would want to do business with, we have a contract with them, so we write for them. And by the way, we don't set the premiums. The insurance companies always do. They do that. But they offer household discounts. Now, some companies offer you a household discount in the neighborhood of about 5 to 7% off your premium for your plan. Some will actually see sometimes as high as a 15 to 20% discount off of your premium if you meet certain conditions. So let me explain how household discounts work. Some carriers require for them to give you that household discount, both of you have to be with them on their supplemental plan, and they'll give you both a discount, again, anywhere from 5 to 20%. Some carriers say, no, you don't actually have both of you have to be with us, but both of you have to be at least 50. So So you may be going on Medicare at 65 and your spouse is 55. They'll give you a certain discount, again, 5 to 20%. And so that's a household discount as long as you're married or you have a significant other or someone that you can verify that actually lives with you that is above the age of 50. We actually have one carrier right now, as long as you have someone that lives with you above the age of 18, they give you the household discount. So it's going to vary carrier to carrier. Again, some require both of you to be at the same company. Others just require that you have someone else that is either Medicare eligible or above the age of 50. And so the point is, these household discounts are very nice, and that's why many times it's best if both spouses are on Medicare and they want to be on supplemental plans to go with the same company, because those discounts are very, very attractive. All right, so either way, we're going to pay. So what you have to decide is, which system do you want to use? I've shown you the differences, and they're huge, frankly. The only thing that Advantage and supplemental plans have in common is you have to be enrolled in original Medicare A and B. But after that, they're totally different, all right? And so you have to decide which system works for you. And so if we can help in that way, we'd be thrilled to do so. I just want to share this with you, really, our company, MedicareSchool.com. What we do is we make Medicare planning a very easy process and mistake-free, and we guarantee it every single time. Thanks so much.